Alongside the many different types of aid it gives to victims of disasters and war, the Red Cross is known around the world by the nursing personnel, which cares for the sick and injured in hospitals, dispensaries, in cities, towns, and villages, in the country, the bush and the savanna, in the most isolated areas. Enormous efforts were needed to achieve such universal activity in the field of health and nursing care. As the League of Red Cross Societies marks its 50th anniversary, it seemed to us an opportune moment to ask the director of its nursing bureau, Miss Yvonne Hentsch, to speak of this long march towards adequate nursing care around the world. Miss Hentsch, what was the situation of nursing in 1919?
The world in 1919 was hardly recovering from the First World War. Epidemics were rampant, and whereas much progress had been accomplished in surgery, there was still a lack of practice, I would say, in the prevention of disease. And the big problem was to check on those diseases and send out teams to prevent them.
Were these teams made up of partly of Red Cross nurses who had already been trained during the First World War?
The Red Cross in every country had been extremely active during the war in relief and emergency care, and it became quite normal for them to assist their government in meeting the emergency of these epidemics. The League opened in 1920 a course in London where nurses could prepare themselves to become the leaders in public health nursing in their respective countries. There were about 20 nurses in every course, and one course every year.
One hears a lot about the grave shortage of nurses in the world today. Can you tell us a bit why this is so and whether there are remedies for the situation?
Preferably, I would not like to talk about shortage. I think it is more correct to say that there is an increased need. Mm-hmm. And the Red Cross in every country, and therefore the League, is very much aware of that problem. And one of the things Red Cross societies can do is to prepare auxiliary nursing personnel that will help the professional nursing staff. Obviously, the professional staff, both medical and nursing, is in limited quantity in regard to the needs. But they can be efficiently assisted by a number of auxiliaries, volunteers and non-volunteers.
These needs are perhaps the greatest, I would think, in the developing countries. And there is the greatest shortage of medical personnel of all kinds. You've said a bit about training auxiliaries. What else can the Red Cross do to help promote better health among the populations in these countries?
I believe the Red Cross is particularly well equipped to reach the people and to aim at informing every member of the society, of the community, how to care for his or her own personal health, and from that to care for the health of the family.
We've often talked about the health teams who go out from certain countries in times of emergency. What type of qualifications is needed of a nurse for this type of work?
First and foremost, she must be flexible. Apart from having the skills in nursing, she must be a person who adapts easily to different situations. She must be the person in each case that is going to best meet the needs of that situation. A refugee situation can be different in different times and different countries. It may be that she will have more to face epidemics or more to face just nutrition and mother and baby care. It all depends, really, and the nurses who go out to assist in such situations must be selected mainly in view of the need of that particular group of people they're going to care for.
To conclude, Miss Hentsch, do you feel confident in the future that the Red Cross will be able to attract this type of person into the nursing profession?
I do, yes. I think there is a great challenge for the nursing profession and for the nursing personnel as a whole to participate in Red Cross work. In fact, that personnel has a unique service to give, which the Red Cross is in great need of. And if that can be explained, they will find that challenge, and I'm very hopeful that the nursing profession will contribute more and more to the positive action of Red Cross in bringing every member of the community to a better health.
Thank you, Ms. Hentsch.